Hello, everyone. Greetings, ladies and gentlemen. This is your friend and brother, O Doctor. You are welcome to my channel. In this YouTube channel, we do nothing but to use people's errors, people's mistakes, people's ignorance to, enlighten you and educate you. Experience has shown me that information is more powerful than medication, and I have come to observe that when it comes to the things of health, the things of disease conditions, and people tend to have their own ideology and their own belief. And when we see some of these things in the clinic, in the hospital, we tend to bring it to the fore so that those that care to learn would learn. That is wisdom. You learn from the mistake of others so that you don't have to repeat the same mistake before you learn. A woman came to the clinic and he came for a different complaint altogether. And I checked the blood pressure and the BP was around 160, 110. So when I explained to the woman that she has hypertension, she was rejecting it. That, doctor, I'm fine. I don't have any symptom. In fact, don't say that again, So that was what necessitated this video. So that will let us just talk about this hypertension that everybody claims to know. And probably at the end of the day, you might have one or two messages to take home. All right. So let's start this way. Definition: what is hypertension? All right. Hypertension is defined as persistent elevation in the blood pressure. That is the key word there. That's the elevation of blood pressure must be persistent, before we regard it as hypertension. All right. Because there are some things that can give you transient increase in the blood pressure, like anxiety, or the death of someone can make your BP to rise on the transient basis. We cannot just call that hypertension. But when it becomes persistent, it is now hypertension. As we go down the lane, you will now get the values. All right. Then what are the types of hypertension? There are two types of hypertension: the systolic, or rather the blood pressure now. Two types of blood pressure: systolic blood pressure and diastolic blood pressure. For example, when we measure blood pressure, we'll tell you, for example, your blood pressure is 120/80. That 120, which is the numerator, is the systolic blood pressure, whereas the 80, the denominator, is regarded as the diastolic blood pressure. What does it signify? The systolic is the pressure in the arteries when the heart, the function of the heart is to compress, to contract, and pump out blood. So when the heart contracts and pumps out blood, the blood pressure in the arteries are the vessels that carry the blood from the heart to all parts of the body, just like the pipes carry water from the town water supply to your home. So that pipe connecting the water from the town to your home is the arteries. So the pressure in those pipes when the water is being pumped is the systolic blood pressure. That is pressure in the arteries when the heart is pumping is systolic blood pressure, and the normal value is less than 120. Then the pressure in the arteries too, when the heart, because after contracting, it will relax. So when the heart is relaxing, the pressure in the arteries is also regarded as the diastolic blood pressure, and the normal value should be less than 80. All right. So normal blood pressure is less than 120 over less than 80. We'll see that later. All right. Okay. Let's just talk about this. According to American Heart Association, all right, the normal blood pressure is less than 120 over less than 80. I've already explained to you systolic and diastolic. All right. Whenever the systolic is between 120 to 129, and the diastolic is still less than 80, it is simply regarded as elevated blood pressure. All right. Then from 130 to 139, and from 80 to 89 is regarded as stage 1 hypertension. From 140 and above and or 90 and above is stage 2 hypertension. From 160 and above, no 160, sorry, from 180 and above to 120 and above is now regarded as hypertensive, crisis. That's a stage you shouldn't allow yourself to reach. It is at that point it becomes, urgent or emergency, as the case may be. So what are the signs and symptoms of hypertension? This is one of the reasons that brought us here, because I told this woman that she has hypertension He said, no, 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 no. That the reason is because hypertension is not like your usual malaria or typhoid or anything that usually come with you have pains, you have fever, you have headache, you lose appetite for food, you are weak, and you have things that will make you to come to hospital. No, hypertension is regarded as the silent killer. All right, in fact, you might even be normal than normal people. You're walking about, looking good, looking bustling and flamboyant, but then the heart is overworking itself, and that is danger. Because so in most cases there may not be any sign or symptom. So in hypertension, the only sign or symptom you may see is you going to check your blood pressure and knowing the value. That's just it. All right, that is very important. Just check it and know what it is. If you are waiting for an evidence, an outward expression of it in the name of sign or symptom, like the headache, fever, that could be the sign of the complication, like stroke, which we will see later. All right, so do not wait for a sign in hypertension. Just check your blood pressure if you are at risk, or if you have blood pressure, you have hypertension. And that will now bring us to the next topic, which is what are the risk factors for hypertension. In other words, who are, since hypertension is not a disease you can just contact. What are the risk factors? Number one risk factor is age. The more you get older, the more you are at risk of being hypertensive or having your blood pressure elevated. The next is race. Blacks have been found to be more susceptible to hypertension than Caucasians. All right. The next is family history. If your dad or your mom is hypertensive, there is a likelihood that you may also be hypertensive. All right. The next is obesity or overweight. Obesity and overweight, this can cause atherosclerosis. Atherosclerosis means blockage of the arteries and that will elevate the blood pressure. The next is lack of exercise. Sedentary lifestyle is a risk factor for hypertension, so you should try as much as you can to do some exercise, at least 30 to 1 hour, 30 minutes to 1 hour every day should be fair. All right. Then tobacco use, of course, smoking, which I've never seen any benefit of it. All right. Smoking will always find itself in almost every disease. So try as much as you can to avoid smoking. As you know already, smokers are liable to die young. All right. The next thing, of course, where smoking always go with alcohol, but in this case, too much alcohol, excessive intake alcohol can lead to hypertension. Then too much salt. If you take too much salt, which contains sodium, it can also raise your blood pressure. Then low potassium, which can be due to dehydration or potassium deficient foods. All right, can make you to can increase your blood pressure. Foods like banana are rich in potassium, so it is always good to maintain your potassium at the normal level. All right. Then the next is stress. Stress can also increase your blood pressure. Then other disease conditions like diabetes or kidney diseases can also, because kidney is a very important organ when it comes to regulating the blood pressure. So when the kidney is diseased, there's a likelihood that you may develop hypertension. Then, of course, pregnancy. Pregnancy, is a risk factor for hypertension. Yes, pregnancy-induced hypertension. So these are the few risk factors that can, so if you find yourself or your relative in any of the categories, it's only fair for you to constantly, check your blood pressure, which is very important, which has been simplified now, but we have so many digital blood pressure checking instruments that you can just get handy and they will give you your reading. It's very important because the complications of hypertension is not what you would want to experience. Just like I said, it is a silent killer that doesn't come, unlike malaria, that if you have malaria, even if you don't go for tests, you definitely know, because the symptoms and signs will bring you down and you find yourself in the hospital. All right. So that's just it. Now let's go to complications of hypertension. Complications are, if you do not manage it very well, what it can result to, the consequences of, abandoning your hypertension untreated. All right. First of all, let's go from head to toe is stroke. Stroke, also known as cardiovascular accident. It can there are two types, ischemic and hemorrhagic. Ischemic means the blood supply to the brain can get blocked and the brain will not receive enough blood. And of course, in that blood is oxygen and nutrients. And when the brain is deprived of this blood containing oxygen and nutrients, the brain cells begin to die off. That's what we call ischemic stroke. In hemorrhagic stroke means that the arteries in the brain can rupture because of the high pressure going to the brain. And when it ruptures, of course, it will form a space of occupying lesion in the brain and even deny the brain the supply of blood and oxygen. And that's when people have to, depending on this the part of the brain affected, the person can develop poor speech, weakness, or even paralysis of the hands and the legs. It can come in different ways depending on the part of the brain, because the brain is like the CPU, the central processing units of the entire body. So depending on the part of the brain that's affected, any part of the body can be affected. Then the eyes, hypertension, when left untreated, can lead to several eye problems. Heart attack and heart failure can also result from long-standing or poorly treated, poorly handled. Remember, hypertension is not curable, all right? It is treatable. There's a difference between treatability and curability. Just like some people say, doctor, ask a woman, are you hypertensive? You say, yes, I used to 5 years ago, but it has. So that's just, and when you check, you see 170, 120. People take medication and say, hey, it's settled. No. It is not curable. You manage it with drugs to keep it at a life-saving range. All right. That's what I mean by it is treatable but not curable. Treatable means that something can be done to help it, but whether our treatment can metamorphose into curability is what we cannot guarantee. So that's what we mean by that. All right. So remember to take your medication and follow up accordingly. When you are told to come to hospital for checkup, it means for the doctor to check and do plus or minus, or to balance things out, because to know that the drug you're taking is enough, or to change, or to add, or to that's the essence of coming to the hospital checkup. Some people take it for granted and they come once and the next thing they will come is stroke. All right, please do not take it for granted, please. Then heart attack and heart failure can result from long-standing hypertension. Of course, kidney problem, just like I told you, kidney is very important when it comes to blood pressure regulation. And because of that, when the kidney is diseased, it can cause hypertension, and when there's hypertension, it can also affect the kidney. Very importantly in a man is erectile dysfunction. This is what every man needs to hear, and we cannot just shy away from it, because I have seen several cases where around 48, 50 something, even 60-year-old men, doctor, I cannot, can you help? Hypertension is one of the commonest causes of erectile dysfunction, which is even modifiable. Just have to be careful with it, with your drugs, and maintain it at a favorable range, and so you have your normal erection. So hypertension causes erectile dysfunction. It is good for you to maintain your blood pressure at a very good range so that you do not have erectile dysfunction. That's just the simple message. And there are several, complications like aneurysm. These are highfalutin words, which I may not bother you with. There are so many complications that can result from hypertension, and the ones we have heard should be enough to help you to understand that, yes, it is really a silent killer, because the complications are quite there. And I mean, it's not something that you should, since it's preventable, just try as much as you can not to get there. All right. So basically, these are the few things I would like you to know about hypertension. If you have any question to ask or any other thing, please, I would like you to drop your comments. Also, I remain your friend and brother, O Doctor. Remember that a sharing of this YouTube channel, or commenting, or inviting your friends would help in disseminating the message. Thank you for checking on us today. See you in my next video.